We are now live on the Diana Wright Show at the 8 o'clock hour. We thank you so much for joining us. And I just want to give a shout out to my good friend Pearl Palmer in New York City. Hope you do well and have a great trip, and hope things just work out and everything turns and God give you all the blessings that you need. Great to speak to you today, and of course, hoping that all things work out good for you. All right, our special guest inside the program this evening is Dr. Melanie Simpson, and we are going to talk to her about all the various issues. And also, I just want to make a point here to say to each and every one of you, I am truly not trying to get anybody to be like me, because there's only one me. I'm unique, and I have some principles and some things that I just know that has to be done the way it's supposed to be done. But, I'm not trying to get anybody to be like me. So don't even go to that avenue, please. Don't go to that avenue. Stay on the avenue of me trying to help you to love yourself and to do the things you say you're going to do, complete your task, and be reliable and loyal and all those good things, because that's just who I am. So don't want to be anyone to be like me, because nobody can be like anybody else, because it's just an individual thing. God made me who I am, and he made you or your child or whatever who they are. My daughter, a total different personality from me. She's more like her dad. So I don't want her to be me, but I want her to be strong enough to defend herself in all situations. I want her to be reliable, and I want her to keep her word, that if she tells you she's going to do something, she does it. So, hence I put that out there. But especially for young people, you have to be loyal. You must do what you say you're going to do. You must complete your projects. Even if the project does not get to where you want it to get, you must complete it. And don't make promises you can't keep to people. And if you are making a promise and you are finding out you can't keep the promise, please call the person and let them know you can't keep the promise. It's just simple. It's not about me, it's about life and how life is supposed to be. So I just want to put that out there so people don't think that I am trying to get anyone to be like me, or because one of the things I truly believe in, that you should meet people where they are, and if you can help them to be a better person, then fine. But if you can't, then it's okay. Okay, Doc, where did you disappear to? I told you not to disappear. Okay, so we're going to bring Dr. Melanie in and ask her some questions. We had some questions from last week that we did not get to, so I'm going to start there, and then I'm going to move on to the new questions that I do have. Okay, Dr. Melanie, welcome to the program. Thank you for joining us. Can you hear me?
Thank you for having me.
Okay, all right. So you can hear me then. What I need to do is probably turn you up just a little bit. There you go. I think I did. Okay. All right. So let's hope we don't have to have Dr. Melanie straining her ears to hear me. But then I'm hearing about myself now, so I'm not so sure what is happening on your end. All right, so I'm just going to turn you up here and hope that you hear things a little better. Okay, first of all, I want to start off with tuberculosis, because a lot of people know that is one of the issues that's creating a problem for Nelson Mandela. He contracted TB in prison, and it has actually haunted him all his life. So what can you tell us about TB, and why is it that also some people who are inoculated in the islands, in the Caribbean, okay, they come here and people are thinking that they were not did not have the vaccine. So why is that? Is there a difference between the vaccine that you get in the Caribbean and the one that you get here?
So for most people who come from the islands or foreign countries, they usually get what's called the BCG vaccine.
Okay.
And that's the shortened, abbreviated version for the true name.
Okay.
And so usually if you get the BCG vaccine, most people, you'll notice they have a scar on their upper arm,
right?
Which arm they might have gotten that injection in. And that basically will come up positive if they go and they're tested by having the PPD placed in their arm. So they're going to come up positive regardless because, they've been inoculated with this particular drug. And so for people who have taken the BCG vaccine, it's pointless to get a PPD test done. What they should have done is a chest x-ray at that point.
Okay.
Tuberculosis in itself is an airborne disease. So what the problem is with TB if you're exposed to someone with tuberculosis. So this could be someone who's homeless, someone who's in a nursing home, somebody who may have traveled overseas. Particularly in many cases, they talk about going to Africa, for example, as a foreign country. And the risk with TB is that these people can die if there's no intervention done. So tuberculosis loves air, so it travels in that medium. And so because of this, people who are positive carriers of tuberculosis have to have isolation take place. So they're quarantined, if you will. And the room has to be pressurized. So, for example, if you go to the hospital and there's someone who presents, and has positive tuberculosis, then this person has to be in a room that's pressurized to contain.
Ooh, sorry. Go ahead.
Still adjusting to contain this particular disease state so that other people are not affected by the disease.
Okay.
Let me just check this on my end.
Yeah, I think something is wrong on your end.
Is that better?
Because, go ahead and speak. Go ahead.
Okay. In addition to that, they also have to recommend that, we wear masks in order to protect ourselves from being affected by this particular disease because, like I said, TB is very deadly, and if you're not treated right away, then, that's a patient that can literally die overnight. The other problem is with prolonged TB that's untreated or that has progressed significantly, it can turn into what they call Pott's disease. And what it does is this particular disease affects the spine, and so it's almost like their spine will look like a rat took a bite out of it. So it can completely affect the entire spinal column, and then their spine starts to degenerate or crumble, if you will. And so that's a problem with having tuberculosis that's untreated.
Okay. All right. So let's move from TB, and obviously it follows you for a long time because Nelson Mandela has been kind of struggling, I gather, for years and years, and that's the problem that he's having right now with his lungs.
Right. And so what the disease does after a while is, it does affect the lung, and so with prolonged disease state, the entire lung in itself can become infiltrated with this disease, and after a while this patient develops extreme shortness of breath. In some cases people can cough up blood, what they call hemoptysis.
Wow.
And they can have fevers and chills, they can lose weight, so they can have all the signs of an actual cancer patient because of how significant this disease has progressed.
Okay, all right. I wanna ask you something about some. I was walking. I don't even remember where I was, and a lady was telling me about vitamin M and vitamin K. Tell us about those vitamins, because I've never even heard of.
K, but I did not hear the first one.
Vitamin M, as in Mary.
Vitamin M?
Yes, as in Mary. I've never heard of that. Is there such a vitamin? Yeah, because
I'm assuming vitamin N must be a man of some sort because I've never heard of that myself.
Yeah, because she said to me,
But,
I'm taking my vitamin M," and I'm going, "Vitamin M? I've never heard of that."
I've heard vitamin M in the past. I mean, a long time ago, but it had to do with a male.
Okay.
Then vitamin S they refer to as sex, and then of course vitamin K does really exist.
Oh, okay. She was just probably pulling my legs, but I said, "Okay, don't worry. I'm going to ask my doctor." But she didn't know what I was talking about.
That's produced in the liver, and that's important because the factors 2, 7, 9, and 10 are very important factors with regards to vitamin K. And so what's important about this particular vitamin, it's associated with what they call the clotting cascade. So if you were to get a cut, you want to make sure that your vitamin K levels are within normal range, because that's what's going to help with preventing you from bleeding out. And so, for example, with babies, when they're born, little boys, if they're going to be circumcised, you want to make sure that these little boys get their vitamin K injections, because they're not able to clot their own blood when they're first born. They don't have that ability to do that. So imagine if you circumcised a young boy or a baby, if you will, and they're bleeding out from having a circumcision done. That would be a very bad outcome. So babies do get vitamin K injections when they're first born.
Okay, vitamin K. So now we know what vitamin K is all about. Vitamin M might just be something that lady was pulling my legs about. I think so now. Because now that I'm thinking about it, she might just be saying that, Anyway, there is something about getting a physical every year. Is that something that we really must do, should do, not so sure? Because the reason I'm bringing this up is because we were told that, actually Dax told me that he was watching a program with all doctors, and that's one of the things that they said, because when you go and you do your physical, then you have the doctor trying to find a whole lot of things wrong with you so they can give you some medication to go take. So how should we actually look at this?
In truth and in fact, if you think about it, our bodies change every single day. And so there are numerous things that can take place or occur in the body over a year's time. So your cholesterol might have been okay this year, but it doesn't mean it's going to be okay next year when it's checked, because your dietary habits may have changed. You may or may not have increased your exercise regimen, or you may have started exercising, for that matter. The other thing is you may have lost weight, so your weight has changed as well. And in some cases, people become overindulgent because their physical was great this year, so they figure, they can slack off a little bit. And so when they go back next year, things might totally have changed. You might have developed high blood pressure when you go back. You may be pre-diabetic or glucose intolerance, and different things that can happen. So having a physical on a yearly basis is a very good idea, because if nothing else, having your blood tested is extremely important, because there's no way to determine, other than getting a blood draw, what really is going on in your body at any given time. So, your symptoms may have changed. This year you're sleeping extremely well. Next year you're very stressed out, so you're not sleeping as well, and other things that may have come into play that, affect how you feel overall on a daily basis. And so, in addition to just your routine physical, sometimes there are questions that you have that you wouldn't normally go to your physician and ask, but at your physical, there are certain questions that you can bring up at that time, because maybe you're too busy every other time to go and see the doctor for whatever's going on in your body. So it's a good idea to have that done every year. There's some people who will be compliant for insurance purposes and get that done every year, and there's some people who they really don't care. They figure they feel fine. There's nothing wrong. So why, go and dig up something that potentially might present itself that I don't want to know about right now. So.
Okay. All right.
But it's a good idea.
It's a good idea to do your physical. Okay. All right. Whether you like doctors or not, you should do your physical. Anyway, I want to move into blood pressure. Because what exactly is the correct reading to have, the normal reading to say that I do not have this thing which is called high blood pressure?
So with regards to blood pressure, there's what they call pre-hypertension, or, before you actually get to that point where we diagnose you as having elevated blood pressure. So pre-hypertension is a blood pressure that's less than 120 over less than 80. So your systolic number is the 120, and then your diastolic number is the 80. And what's important about these numbers is if any one of them are completely outside the range of normal, it can affect you adversely. So if you have a blood pressure that's ranging between 130 to 139 and then 80 to 89, that's kind of what you call stage 1
Scary.
hypertension. And then 140 to about 159, over 90 to about 99, that's stage 2. Well, anything over 160 equal to or greater than 160, or anything over 100 greater than or equal to 100, that's extremely uncontrolled blood pressure, and that can have very significant side effects. So, for example, somebody can develop chronic headaches because their blood pressures are not controlled. They can have visual changes because their blood pressure is not controlled. They can have a stroke. They can have a heart attack. They can develop kidney failure because of uncontrolled blood pressures. So as you can see, just from, the minor things that I've mentioned, it's very important that our blood pressures are controlled appropriately. Things that you have to consider that can cause your blood pressure to be out of control is a family history. So if you have a family history of high blood pressure, well, there are a lot of things you can inherit. You may inherit wealth, but you may also inherit very bad genes, And so one of the things that you may inherit is elevated blood pressures that require medication control.
Right.
In some cases, you can control blood pressures without using medications by dietary changes. Some people can lose weight as well, and that can also help with better blood pressure control. Monitoring your salt intake, not because you've added Mrs. Dash in the pot when you get to, the table and you're going to eat your food, that you actually have to add additional salt to it. And so many times we do that. Sometimes you go out to eat, you don't really like the way the food tastes, so you add your own salt to it, and that's, you can't say behind the scenes what they've used to season this meat that is sitting in front of you. And so sometimes you're increasing the salt content tremendously. And then in addition to that, we have a lot of smokers now. Everybody's stressed out, and so they've started smoking. And that also affects your blood pressure as well.
Smoking, no.
And then there are people who drink, and alcohol also affects your blood pressure. So as you can see, there are many things that you have to consider with regards to things that can be secondary causes of elevated blood pressures. In addition to that, there's some people that have thyroid dysfunction. So your thyroid gland controls your metabolism, and if your thyroid function is above normal, or what they call your hyperthyroid, that can also cause elevations in your blood pressure as well.
Okay, my special guest inside the Diana Wright Show this evening at the 8 o'clock hour is Dr. Melanie Simpson, and we're talking about some medical issues that we hope that you will pay attention to, and it will give you some more information about things that you're not really thinking about, because none of us want to think about that we're getting sick, we're getting older, and we must get older. There's nothing you can do about it. Even if you have a facelift, your internal organs is still the same age that you are. Okay?
Exactly.
Yeah, so, a lot of people, they go and they have all these outer things done, and then internally, they're still the same age that they really are. So, just want to caution you about that. Okay, let's talk about systolic is the one on the top, right?
Yes.
The number on the top. Okay, the diastolic is one at the bottom. Which one is the one that is the most dangerous one, that when it rises you need to pay attention?
Well, with regards to diastolic blood pressure, why that's a significant concern, or would be a significant concern, is because during diastole, your heart is supposed to be relaxing in order to fill up with blood so you can start another cardiac cycle, so that you can actually pump blood out to your system. Again, so there's that love dub. So if you think about it, and I'll just kind of make the sound so you can hear it.
Right.
Like the way the heart would be.
Okay.
So when your heart is supposed to be relaxing, now if you think about it, it's going up a gradient. So the higher your diastolic number is, or the bottom number, now your heart has to go to an elevated pressure above 80, which is normal, all the way up to 90, in some cases 95, in some cases 100, in some cases for some people 120. So depending on how high your diastolic goes, you're climbing this gradient, and the greater the gradient, the more work your heart is doing. So your cardiac output, which is, the pumping out of your heart, the number of liters per minute, which 5 liters per minute is usually what the heart normally does. which is a lot of fluid, a lot of volume. So if you think about it, if your heart has to do twice the amount of work it normally would do because maybe you're extremely obese, maybe you're a smoker, maybe you're consuming alcohol a lot more than usual, maybe there's elevated stress, maybe there's thyroid disease, all these different factors. Now your heart is working extremely hard, and so it has to overcome this gradient in order to pump blood out to your systems. So you can just imagine that increased stress is why people end up having heart failure. Because if it cannot climb this gradient, it's going to basically collapse, so to speak. And that's how people end up in congestive heart failure.
Okay, so the diastolic is the one that is, in your opinion, I guess it's more dangerous if it goes above 80. Is that what it is?
Yes.
Okay. And the
both are extremely dangerous, but the diastolic is even more concerning.
So what is the ideal number for the diastolic? The ideal number?
Say that one more time.
What is the ideal number for the diastolic?
Preferably less than 80, but 80 is acceptable. If somebody is on blood pressure medications, for example, they're on one oral agent, so of course a pill by mouth, then the acceptable high normal, depending on the secondary comorbid or other conditions that they may have, 140 over 90 is about considered acceptable. But that's still not a good number.
Okay.
However, if you have somebody who is a diabetic, for example, their numbers should be less than 130 over 80.
Oh, I see.
That's really what's considered acceptable.
Right.
Some people with kidney disease, they kind of look for about less than or equal to 135 over 85. However, if you have someone who has what they call aortic stenosis, so basically there's a narrowing of the aortic valve which leads out from the ventricle on the left side to actually pump oxygenated blood out to the body, they require a little bit higher blood pressures because they don't have as much volume because of that narrowing of that particular valve. And so depending on the other conditions that a patient may have, it's very important to monitor how well their blood pressure is controlled. And a lot of people that present with very elevated blood pressures, one of the things they always complain about in many cases is headaches. That's something that most people complain about. And then you also have to think about people who do illegal drugs that they usually have elevated blood pressures. For example, cocaine. That's one of the popular drugs that's out there. It doesn't sound like it's popular, but it's very popular for some people, especially a lot of young people now, that are trying all these different drugs. So that particular drug causes vasoconstriction or narrowing of the artery in the brain. So it's kind of, going into a vasospasm kind of a effect. And so you have decreased blood flow, so you have elevated pressures because it's trying to overcome the pressure in order to allow flow inside the brain. Well, if you have decreased brain, oxygenation, then of course the person will end up with a stroke. And so that's one of the things that you have to think about as well with elevated blood pressures.
Okay, Dr. Melanie is a general practitioner, and those are rare these days, so that's the reason we ask her a wide base of questions. I want to go back to the diastolic. Is there diet that can actually get that thing down? Is there a diet that you can, I'm not talking about the DASH diet now, is there something that you can do personally as a person to help yourself with that particular number going down?
Well, for some people, there are different stories. Some people will say they put cinnamon on their food and that lowers their blood pressure.
I thought cinnamon was for diabetes.
And I mean, it does work for some people, but everybody's body is not the same.
Exactly.
And so cinnamon may work for you today, but it may not necessarily work next year. You know what I mean? So there's some people who, unfortunately, despite, all of the natural avenues that they try to control their blood pressures, end up being on an actual oral agent to help them with blood pressure control. And then in some cases, there's some people who one medication is just not enough, and they have to have multiple drugs in order to control their blood pressures. So I mean, There are also people who have sleep apnea, because sleep apnea can also elevate blood pressures as well.
Okay.
So there's some people who have obstructive sleep apnea, and what that does is it causes increased pressures on the right side of the heart. So a lot of people can end up with what they can call pulmonary hypertension. So hypertension, of course, elevated pressure, and pulmonary in the lung, because the right side of the heart, the blood gets backed up, and where does it have to go to get oxygen? To the lung. And so these two systems get affected, and they can have elevated blood pressure. So there are many, many different things that can contribute to, unfortunately, uncontrolled blood pressures.
Okay, sleep apnea is that the thing where you are sleeping, but if someone is sleeping beside you, you look like you're not breathing? Is that the one? That's sleep apnea?
So you stop breathing.
Yes, because I have a cousin who has sleep apnea. And when she told me, I was like, what? You don't breathe?
A lot of people who are extremely obese, for example, in many cases, have been found to be people with sleep apnea. And it doesn't mean because everybody is overweight, so to speak, that's why they have sleep apnea, but there's some people who their oxygen level drops in the middle of the night, or while they're sleeping, it's, less than normal, and it's sometimes in the 80s. Sometimes for some people it's even less than that. And it causes them, they're snoring, and it causes them to actually wake up to catch their breath.
Wow.
So those are the people that often require machines, like a CPAP, for example, to provide positive pressure during the night so that they're able to get a better night's sleep. And that also helps with, taking away a lot of the stress on the heart as far as the elevation.
Okay, all right. Okay, we're just losing the sound there for a minute with Dr. Melanie, but just reminding you, I knew that was going to happen, so we'll just take that down for a minute until we get her back. There we go, we got her back. Okay, all right. I want to talk a little bit about circulation, because I don't know if it's sometimes certain drugs you take that can make that happen, like your toes get a little crampy in your bed, or some people just have a circulation issue with their feet. What causes that?
So if someone has peripheral arterial disease, or we call it PAD, or peripheral vascular disease, which is PVD, then they can have extreme swelling that occurs in their feet with, just walking even a short distance. And so in many cases, it's usually hereditary. And a lot of folks tend to have varicose veins in many cases, if it's from a vascular standpoint, where it's your venous system that's affected.
Right.
And so these people will have very large varicose veins, and this can be very painful too. In terms of them walking, it's difficult walking, and sometimes they'll notice a slight discoloration of their lower extremity as well, and they call this venous stasis. So basically what happens is their blood flow is decreased in their legs, and because of that, they're at risk of developing ulcers in some cases. In addition to that, they often complain about what's called rest pain if it's from an arterial perspective. So, you might be lying on the bed and your feet are kind of hanging over the bed, and all of a sudden your legs go numb, or you'll feel extreme pain in your legs or something like that. And so sometimes they'll also complain of what we call, from a medical perspective, intermittent claudication. That's just a big fancy term for cramping in your legs with walking. That tends to feel better a little bit after you rest. Okay. And so with any of these particular symptoms, usually you want to have someone to do an arterial lower extremity study or an ultrasound as well of their legs, just to see what their blood flow is. And sometimes there's an actual occlusion or a blockage that's in the arterial system of the leg or the venous system of the leg. And then sometimes somebody might have an actual clot in their leg, so a deep vein thrombosis that can cause them to have severe pain in their calf and swelling, usually unilateral. So usually only one leg is swollen when it's the case of a DVT. So there are many things that you have to consider when your legs are cramping. And sometimes it could just be that someone has a deficiency in a particular electrolyte. So sometimes their potassium level is too low, and that can also cause cramping in the legs. But arterial and venous disease of the lower extremities is pretty significant because it can be very debilitating.
Okay, so if I'm sitting in this chair now, like I am, and the way I have my feet sitting on the iron portion, and my toes get a little crampy, is that something to worry about, or is it just because of the way I'm sitting?
It's very good when you're sitting down in general, whether or not you have any kind of abnormalities, that you elevate your legs, and usually it's recommended that you elevate it above the level of your heart. So whether you are sitting down or lying down, it's usually good that you keep your legs elevated, because what happens is when you stand, you pool blood, or blood pools down to your feet.
Right.
And then when you lie down, that blood gets to return to your heart. So it's very, very good that you have your legs elevated when you're sitting or lying down. And in cases where people have extreme swelling in their lower extremities, they can wear compression stockings. These, for some people, number one, are not very sexy. Number two, are not very comfortable. So some people are not very excited about the idea of putting on compression hose, but it does help. It does help.
It's just like the diabetic shoes that most people don't want to wear.
Yeah.
Oh my goodness. Okay. Yeah, because when I sit like this, I'm sitting up, and I have my toes pressed in so I don't kind of go under the table. I can feel, my toes sometimes gets a little cramped up, and I'm like, okay, what's this now? It can't be anything but just the way I'm sitting at the moment. Okay, so, all right. I want to move to something that is controversial, but people are talking about it. It's medical marijuana. Medical marijuana is said to be creating wonders, miracles, and all those things. But then sometimes, like today, I saw medical marijuana not recommended for teenagers with chronic pain. So is medical marijuana a real thing, or are people just using it to get high and tell me that it's working?
Well, this...
Yeah, because I'm just thinking...
For lack of a better way to put it, there's a big stink that's going on now about this whole topic in itself.
Yes.
Like, for example, a lot of patients with chronic pain, especially in states where it's not legal, complain, everybody else is doing it and it's natural and I don't understand and what's the big deal and it's not harmful and it's better than taking chronic drugs that can give you, all these other side effects. However, keywords, it is not legal. If it is not legal, then it should not even really be a topic of discussion. And it's not to really put anyone down who chooses to do whatever they choose to do.
Right.
But at the end of the day, everything comes with some sort of side effect. It may not present now, but it may present later. And for people who usually are the biggest culprits in terms of use, it's usually cancer patients.
Yes.
Or, of course, patients with chronic pain.
Right.
And what do they tell you? Oh, it helps my pain symptoms. It helps my appetite. I find that I can't really eat as much, and it gives me the munchies, and so my appetite is better, and I'll maintain my weight, and all these different stories. And I don't really think it's a bag of hoax, so to speak, but at the end of the day, it is illegal, and no matter what you tell us as practitioners, if we say we cannot prescribe it, don't come to our office constantly asking, why can't I just get a prescription that says it's okay for me to use? Because it's not okay.
Okay.
That's just all it is. It's not okay.
Yeah, because I've been thinking about it, and I'm going, okay, are people, because if you're taking marijuana, as a lot of people say, it takes you to another level, another place, So is it that you're at that other place so you're not feeling the pain? And it's subconsciously you're thinking that you're feeling better, but you're really not feeling better, because when the high has worn thin, then the pain comes back.
And one of the problems, and I mean, this is not necessarily the case for everyone, But one of the problems is there are many people who start out with that mild drug, so to speak,
Right.
and then they end up with even stronger, more dangerous drugs in their system.
Ah.
And so, you know, telling someone that they cannot use it, for some people that's not acceptable. But at the end of the day, it goes back to, I cannot tell you what to do. You have the choice, and I can advise you of what you should not do. But at the end of the day, people are going to make their decisions. But however, if I'm providing chronic pain management therapy to someone and they come up positive, we're going to have a problem.
Okay. All righty. That's what Dr. Melanie says. She's our special guest inside the Diana Wright Show live at the 8 o'clock hour. And we're talking about marijuana for medication. Lots of people are getting busted. There are states that it's legal for medical marijuana, like California and Colorado and a few others.
Right.
But is it really working, or is it just mind over matter because you're so high, so you think it's working? Because if you're high, obviously you're not going to feel any pain, I would think. But anyway, what do I know? I didn't even know what a marijuana plant looked like until I came to live in the United States. I saw it on someone's window in their apartment in New York City. So, you
And
know.
I think I wanted to add as an aside,
Yes.
one of the things I would advise people to do is, because we've seen this in practice, is to be very careful of whoever, you know, their suppliers are, because one of the things that people are doing now is they're lacing it with cocaine. So
Oh.
you might just be thinking that you're just getting, quote unquote, a joint, but the joint is actually laced with another drug.
Wow.
That can be very dangerous. And I had a situation in, you know, the past where I had a patient who has cardiac issues or heart problems, and this person came up positive, you know, in a screen with marijuana.
Wow.
And the problem is they also came up positive for cocaine. Well, the person, you know, said, admittedly, I do use marijuana. However, I do not use cocaine. And, you know, in going back, in researching their supplier, you know,
Right.
on their own, not us going to find anybody who supplied whatever, but in the person going back on their own because they ended up having a heart attack, you know, they said they really were very upset because what they were sold actually was laced with something else.
Right.
And, you know, people are busy making marijuana brownies and they're doing the tea and they're
Yes,
doing all this stuff.
exactly.
Well, you don't necessarily know if that's all
That's in it.
this illegal substance that's in whatever it is that you're getting. So, you know, you do have to beware that there might be something else at stake as well.
Yeah, because they have cookies, they have brownies, they have all kind of stuff, and I'm going, what? Whatever. Okay. All right, moving right along. Red meat is said to raise the risk of getting type 2 diabetes. I read that today, and I was a little taken by that study.
You'll have to repeat. Did not hear that. I'm sorry.
Okay, red meat raises the risk of getting type 2 diabetes?
Oh, red meat.
Yes.
Oh, okay.
Is that so? I saw that today and I just thought I'd ask you the question because I never thought of equating red meat with diabetes, type 2 diabetes, seriously.
I don't know if it's just attributing red meat in general
Right.
to that. You know, because red meat has a lot of iron in it, but at the same time, meat in general, the body has a hard time digesting meat in
Well,
general.
my body
'cause, you know,
does,
we were
yeah.
really developed, or we were really created to really consume fruits and vegetables and nuts and grains.
Yes.
And so the body has a tough time with really digesting meat. So the tougher the meat, so to speak, or the more complex the protein, the harder it is for the body to actually digest it. So you have to think about it. Once this is broken down, this protein is broken down to a storage form and goes and sits and hangs out in the liver until the body, you know, the cells are in need of an energy source, then it's going to draw from that stored sugar in order to make energy available to the cells of the body so it can function the way it should. And so if there's complex carbohydrates, proteins, whatever it is that's sitting in your body, too much of anything is never good. And so all things in moderation. With that being said, the risk of diabetes, and not just diabetes, but other gastrointestinal problems can occur, and so the risk of diabetes, depending on the types of meat that you consume, can be a factor. But in general, if you eat well, you have to watch your portion sizes. Remember, I said previously, when you eat, the amount of meat that you consume should be like the size of the palm of your hand. Well, the palm of your hand, everybody's palm is different. So
some people are bigger.
Just a little bit, and somebody else's palm might be 3 times the size of my hand. And so they think, that's what they should be consuming. However, when your body is full, it will let you know that. Not when you feel that your body is full. But when your body is full, it'll let you know. And one of the factors with regards to diabetes development is a lot of people eat on demand, and not just eating on demand. They don't take time to digest what they're eating. So right now, let's say, and this is just to wrap it up, but let's say I've just eaten, something from, I don't want to put any particular fast food place out there, but let's just say I took a chicken sandwich from McDonald's and fries, and I had a smoothie, and I'm on the go. And then I pass by Krispy Kreme, and I say, oh, well,
let me have a donut because the light is on and it's hot.
You go home and you forget you had the Krispy Kreme, and you forget the McDonald's, and now you're sitting down watching a good movie, and you want some ice cream, and you forgot there was banana bread or cheesecake in the refrigerator. I mean, so, and the eating just continues and continues, and before you know it, you now have a disease state that is chronic, and now you have to deal with that. So we have to be very careful with what we consume, whether it's red meat, it's white meat, it's the other dark meat. I mean, people have all kinds of names for these things now.
Yeah.
But whatever it is, we have to be careful of what we put into our bodies, and don't just eat. Remember, exercising is extremely important because you need to burn off all those calories that you just consumed.
Okay, so that's what we would call mindless eating?
Yeah.
Okay, all right. I want to ask you about, remember we talked about Michael Douglas a couple weeks ago, and now I see there's blood tests that may detect sexually transmitted throat cancer years before the symptoms of the disease become apparent. Is that kind of fact or fiction? Or they try to make us really feel very happy about something?
Well, sometimes when you ask me questions, you have me stumped, and I just have to think for a minute.
Okay, I'm sorry.
No, that's fine. That's fine. That's what it's about.
Okay.
But I would say, technology has become so advanced, and there's so much more that we know now from a scientific point of view than we did years before. And so particular disease states that would take, many, many years to manifest and to be discovered are now screenable in many cases. And so we can prevent very significant adverse outcomes compared to previous times. And in general, like I said to people before, beware of who you kiss. I mean, if you think about throat cancer, I mean, there are many things that you can contract from just the mouth itself. And we had discussions before about oral sex. There's discussion about, smoking, because you can develop oral cancer from smoking.
Right.
So there are many, many things that we have to think about with regards to disease processes. And now with regards to STDs, we have blood tests that are available that can allow us to detect these disease states before they become a significant problem. However, careless, reckless behavior causes many of the problems that people are now dealing with at a later date. And it doesn't mean you're pointing fingers at someone and saying, you should have thought about this before. True, that is true. But if you are now the person that has something chronic that you now have to deal with, then you're just at that place. You just now have to deal with it. And so going forward, it's about educating those who are around you and educating yourself. And that's really what the best prevention is for any disease state. It's really educating yourself so that you don't become a victim to something. It's different if you develop a disease process because of a family history. Well, for example, and this is just kind of going back a little bit, but if you think about Angelina Jolie, if she wasn't proactive, maybe 5 years down the line, she would be dealing with something else compared to the fact that she made such an aggressive decision now. So the same goes for all of us. We all have the resources in terms of information. It's right at your fingertips. Everybody's busy tweeting and Facebooking and all this other stuff. Get on the internet and research some of the things that are out there that you may know of friends that are affected by it or family members, and educate yourself. And for those things that you cannot find, answers to, there's always a physician that you can always ask, and they can potentially point you in the right direction.
All right, my special guest inside the Diana Wright Show this evening is Dr. Melanie Simpson, a general practitioner, and she's here with us in Florida. So if you want to meet her, you have to come to Florida. But anyway, I want to ask you something that I thought was quite interesting that I picked up this evening. And there's a man in Delaware who lost his case against a doctor. He was suing his doctor for negligence. And the surgery was a penile implant procedure. And the truck driver, the guy who had the surgery, is a truck driver, and he has had an erection for 8 months. So that's the reason he decided to sue the doctor who did the surgery. Now, let me just start with, what is a penile implant procedure, please?
Okay, so, some of these questions, Diana.
Oh my goodness. Well, you know that I do a lot of homework, don't you?
I do know you do a lot of research. I know that for sure, and we all have figured this out by now. But with the penile implant, it's a device that's basically inserted, if you will, into the penis to make sure that this person actually is able to have an erection. So
okay.
These men are people who are not able to have an erection, and because of that, and it might be from a disease process, in some cases diabetes or whatever, and they decide that they want to have this intervention done. Well, like all good things, some things come with a bad outcome.
Yes.
And it's very unfortunate for someone to have had an erection for 8 months. I mean, that's got to be extremely painful.
Yeah, and I'm not laughing. I just wanted to clear that I'm not laughing at the guy. I just thought, when I saw the story, I was like, oh my God, I have to ask Dr. Melanie about this. What on earth is this penile, implant procedure? What is it?
Because what I was going to say is, when you have the penis to be erect, one of the things we have to think about is how this occurs is a natural process where there's increased blood flow or vascularity to that particular area based on, sexual stimulation. So if somebody actually has this penile implant in place, sometimes people would joke around and say, do they pull a string? Do they touch a button? How do they get this thing to work? But the first dissection I ever performed in medical school, our cadaver actually had one of these in place. And I can honestly tell you, we were very, very bad students because somebody attached a string to it and went outside the window of the actual laboratory. And what they did was, when the preceptor came over, they kept pulling on the string. So she kept saying, I don't understand, why is this thing happening every single time I come here? And she never got a clue because the string was so small. But I just say all of that jokingly to say, it has to be an extremely painful process, because most cases where priapism takes place or a sustained erection, it's usually patients with sickle cell disease that they have that to occur. And when they have that occur, what they have to actually do is get the blood drained from the area in order to get this erection to no longer exist, on a sustained basis like that. So in a case like this, I mean, this person really should have this implant removed because there's some defect somewhere. And I mean, I don't know why they would wait 8 months. I'm not exactly sure of the logic, or I'm not understanding the reasoning behind that. But, everybody's different. I don't know in some cases if it's, to end up in a world record kind of situation or whatever. And I'm not trying to make light of the situation, but I'm just saying, for me, I couldn't understand someone who would wait for an extended period of time, such as 8 months, to have this taken care of, because it's a pretty significant and serious, side effect of this particular implant being done.
Okay, and just to make it even worse, he lost the case that he filed the lawsuit, so I just thought it was interesting. Anyway, okay. Are we to say, this is for me, this is very exciting that there's a woman who actually had her pinky grow back because they used something called ground up pig bladder powder, and they're now saying that humans can regenerate severed limbs with stem cells and with a procedure like this. I think this is fantastic. So is this really something that we're going to be able to see happen?
That's something that actually research has been going on for quite some time now with regards to stem cells. And, if you think about it, it's a great thing because not too many people want to walk around with artificial body parts. Mm-hmm. And so if you're able, through human science, to be able to have a natural process take place with the human body being able to heal itself or regenerate, limbs or certain cells in the body, that's a really good thing because it's less risk of disease processes occurring in many cases. Because sometimes, people end up with, prosthesis and other things, and sometimes they end up getting severe infections and, parts have to be removed. And then, in cases where things get recalled and, it's just a whole, repetitive surgery that's needed. So I think it's a great wave of the future that's taking place right now. Not many people would be too happy with it, but it's kind of like the idea of cloning. A lot of people are not fans of the idea of cloning. And I'm not saying I would want anybody to clone me because, like you said earlier, I don't want anybody to be me. There's just one of me and I don't need two, but it's just kind of the way human minds and creativity and, just the level of intelligence that we've developed over the years. And everybody's curious. Mm-hmm. And everybody wants to be, the next Einstein and the next brilliant person to develop something that's just so amazing. And if you think about it, humans aren't really aiming to really cause harm. We're only trying to understand ourselves and our bodies even more. And whatever we can do to make our lives a little bit better, everybody wants to be anti-wrinkle and anti-aging and anti-this and anti-that. So why not stem cells?
I tell you, I should go back. I would like to be a dermatologist and come up with something that can stop women from aging. Seriously, facially. That would be my next life, okay? All right. There's something here that I found about, I have so many questions, I don't know which one I want to get to before time runs out. There's an HIV protection pill or prevention pill. I'm reading about that. It cuts your risk of the infection in half if you are taking this pill.
Yes, I cannot recall the name of it right now, but I will have it for you next week.
Okay, please do.
Off the top of my head. But yes, there is a medication out there. And, if you think about it, people in the HIV community are extremely happy. And the main reason for a lot of them is because, they've been abstinent or unable to engage in sexual intimacy for such an extended period. And especially for those who are in a marital relationship and, they want to continue having intimate relationships with their significant others, a lot of them are very excited about this new wave of the future where, they're not putting their partner at risk. I will say at the end of the day, everybody has a choice to make and you still have to be extremely careful. It's like anything else. I would not speak against it to say it's not effective because I don't know that of a fact. But I would say, it's about being very careful, very thoughtful, and also the person that you're intimate with, that person is okay with the idea of putting themselves at risk, for lack of a better way of really saying that.
Okay.
And so I support the fact that, again, science is really trying to make multiple breakthroughs in many areas for people to really live a normal life, because that's really what medicine is about. It's really about trying to get people back to baseline to live a normal life as much as is possible.
Okay, all right. Here's something that I thought was quite interesting. Treating one infection at a time in wild mice with several parasites, parasite infection, will or may worsen another. So I equated that with the fact that is there the principle that all these medications that you see being advertised on television, and they will tell you, oh, this can cure or take care of your RA, but then the side effects that they come up with are just so detrimental they can actually kill you or give you cancer. So am I equating this with the fact that a doctor, I think from the University of Edinburgh, is now saying that in mice they have found that once you're treating someone who has multiple infections for one thing, it can actually make the other thing worse.
That's very true. If you think about it, for example, if somebody comes in with a urinary tract infection, they come in with a sinusitis, that may have turned into pneumonia, depending on the actual organism that's causing their infection, there are different antibiotics that are going to be targeted to that particular organism. So if you go to the hospital, for example, and somebody has MRSA, which is methicillin-resistant Staph aureus.
That horrible thing.
You're not going to treat somebody with MRSA with a drug that's not going to target MRSA, even though they might have other things going on in their body. And as long as they don't have a side effect to the particular drug that you're going to use to target whatever it is that you're trying to fight, you are going to use multiple agents in many cases to be able to take care of those bacteria, because you might treat the pneumonia but you might leave out the UTI, so the urinary tract infection is not covered, and you do a blood culture and now they're septic because of the urinary tract infection, so now they have urosepsis. You know what I mean? So with all of that, they can develop antibiotic resistance. Not only that, now they have a candidal infection, so now there's a yeast infection, and now you have to give some diflucan to take care of that. You know what I mean? So there are just multiple things that can occur with using multiple different agents at the same time.
Okay, I'm sure you must have heard by now there's a case of leprosy in Ireland, and the man had it for 10 years and he got it in Brazil, and Brazil has several cases of leprosy. I thought it was a Bible disease and it was done gone.
We all thought leprosy went away.
Yes! How come? What's going on, Doc?
And the same not the same bug, but the same family, Mycobacteria leprae is actually the organism that causes leprosy. And Mycobacterium tuberculosis is what causes tuberculosis. So if you think about it, it's the same family of bacteria that causes those two diseases. So you can see how many times people end up with something else that totally, was not expected.
Oh, can you imagine? We learned something fantastic. Leprosy and TB, same family. Wow, that's interesting. There's a list floating around of the best hospitals in the country. Of course, Florida didn't make the list, but what actually, for you as a doctor, makes a good hospital? What would make that hospital make a list of being the best hospital in the country? There's a long list here. I have it somewhere here.
Say that one more time.
The best hospitals in the country. Florida was not a part of it. But I just wanted to know, as a doctor, what to you makes a good hospital that they would make a list of a top 10?
Well, for a hospital to be considered a part of the top 10, number one, your mortality rate or your death rate has to be pretty low or hopefully non-existent.
Okay.
Actually, the number of readmissions to the hospital, so that's a big thing that insurance companies are now looking at, is your readmission rate. So if you just discharge somebody from the hospital that had pretty significant pneumonia, let's say an elderly, debilitated nursing home patient, and 5 days later they're coming back to the hospital because this pneumonia has not cleared or, you know, some other acute problem, then that's a red flag for that particular institution. Also, in terms of patient satisfaction, so, you know, they usually give us surveys to do when you go to the hospital. Some patients don't like to do the surveys, some family members don't like to complete the surveys, but it does help. Because if you want to have improvement, somebody has to give you feedback, right? And in addition to that, cost. So is it costing that state, the government, is it costing them more money to keep this place open? Are they having more problems in terms of, you know, certain things that they have to financially be responsible for in terms of disease state? Is there an increased level of a particular disease that's in this hospital, or has that rate gone down? And the other thing is hygiene. You know, you have to think about it. How many people wash their hands? So some doctors go from room to room with the stethoscope and they put it on your chest, and they go to somebody else's room and put it on their chest, and then they don't wash their hands in between patients. So, you know, you have to look at all these different risk factors, and depending on the overall outcome of all these different things taken into consideration, and especially if you have a hospital with level 1 trauma. So, you know, what are the rate of trauma that's coming into that hospital? How quickly is the turnaround time? If they tell you we're going to take care of you in 30 minutes, you know, we may not have everything treated, but at least we've gotten you in, we've gotten you signed in, we've gotten your vitals. At least at baseline, a nurse has come and seen you, their orders on your chart within 30 minutes. You know, so there are certain factors that are looked at very carefully and strategically before a hospital gets that wonderful title, and hopefully gets an incentive in terms of cash with that too.
Yes, okay, all right. I wanted to give you something that was said by Jeb Bush. He said that immigrants are normally more hardworking, family-oriented, but the one that really grabbed me was he's thinking that they're more fertile. Are immigrants more fertile than American women, which is what Mr. Bush is saying here?
Maybe it's what they eat.
I just thought I would give you a laugh on that one, yes. And of course, there's also good news for people in the eye industry. There is according to a professor at the University of Nottingham in England, recently found a new layer in the human cornea. So that's also a great discovery in the health industry. So I just wondered if Spanish women are more fertile. So I don't know
necessarily if I would say that they're more fertile, but they probably are. I mean, they don't seem to be as stressed out as, you know, a lot of the other cultures are. And the thing about them is they're extremely fit. I mean, when you think about it, if you look, there might be a car load of them, and the car is supposed to hold 5 people, and there might be 10 in the car. I mean, they're extremely family-oriented. I would definitely say that they're very supportive of one another.
Right.
And it doesn't matter how many children they have. Sometimes you can't even figure out whose child belongs to who.
Because they're all...
You know, everybody assumes the responsibility and kind of plays the role. And so I would agree that there's just something that's very different about their culture in comparison to a lot of other cultures. If they're more fertile, I don't know if a special blessing went on their side. I have no idea. No idea.
Okay, well, Jeb Bush, I think you should consult another doctor to give you some information before you make a statement like that. But anyway, because the American women are quite mad about that. But anyway, thank you so much for joining us. Any final thoughts before you go?
I would just say in closing that, you know, it's always a pleasure to be on. It's highly entertaining most of the time. Actually, it's highly entertaining all the time.
Okay.
I appreciate the questions that have come across, and I would just encourage our listeners to do call in, do have your questions, heard, and I always try my very best to answer whatever questions are posed to the best of my ability. Whatever I have to research, I always make it my duty to try to do so I can get back to you.
Okay.
So of course that will be my thought for next week, is I will have to get back to you with the name of that particular drug that came out recently. I did know it on the tip of my tongue, but considering I have not had to prescribe that to anyone.
Oh, well, I'm happy to know that. That's a good thing
right now, but I would say, just in general, be very careful and mindful of your health. The only person that can be held responsible for that is you. And, even though you have physicians, you have nurses, we are here as a secondary support system, but you are the primary person. You own your own temple. I don't own your temple. I can encourage you on what to do. I can advise you on what to do, but at the end, the decision, the choice is yours. And in cases where, there are parents and children, and the parents make the decision on behalf of the child, you always want to do what's within the best interest. And always remember that physicians are advocates for the patients.
All right.
That's the purpose of medicine.
Okay. Thank you so much for joining us. Great show. And we hope we helped some people with some information this evening. Thank you so much, and have a great evening.
You too.
All right. Bye-bye. Okay, that was Dr. Melanie Simpson, and she joins us every Tuesday at the 8 o'clock hour of the Diana Wright Show. We thank her so much for joining us, and as usual, if you love something, set it free. If it comes back, it's yours. If it doesn't, it was never yours. And also, I just remind you that April 30th is indeed I Love Me Day. It is I Love Me Day. I Love Me Day. Have you loved yourself today? Remember years ago they used to ask you, have you hugged your child today? Well, I'm simply asking you, have you loved yourself today? We hope you loved yourself today. We hope you did. And if you haven't, you still have a couple hours left in the evening to love yourself. So make sure that whatever you do and however you have to do it, you should and you must love yourself every single day. Not trying to be anybody else, not wanting to be anybody else, not trying to even make you be like me. No, no, no. That's not the point. The point is just do what you say you're going to do and be loyal. And of course, the three little words that are so important. I love me. How about that? Thank you so much for joining me as I say au revoir and adios and ciao to you from around the world and in the United States. We hope that we have given you some information from Dr. Melanie Simpson, the general practitioner, that you can use not necessarily for yourself, but you can pass it on to someone else. And next week, Dr. Simpson will let us know what is the name of that HIV prevention pill that I was talking about, that I discovered and found out about. Do your own research, as she says, and your health and your wellness belongs to you and you alone. Have a great evening, and thank you again for joining me, and we'll see you tomorrow morning at the 10:30 hour of the Diana Wright Show, when we will talk about wellness. So, I think Dax is still floating around Iceland, but you never know. We will see you tomorrow morning, and we will still talk about some wellness stuff that is good for you, and just encourage you to continue to be well and live well and stay well, as Dax would normally say. Have a great evening, and ciao. Do, do, do.